So we have in already in the last class we have seen regarding the post-exposure prophylaxis. Now next we will be moving on to the standard safety precautions. Okay, so this is the continuation of this immunology unit. Okay, so what is the particular standard safety precautions that has to be followed for a HIV patient? Already you may be aware of it, isn't it? So in this figure also you can see normally we have to follow the universal precautions. Okay, so universal precautions have to be followed, which is also referred as standard safety precautions. Okay, sometimes it is also referred as barrier nursing or barrier precautions. Okay, so standard safety precautions, it is used to prevent the transmission of HIV infections or hepatitis B like infection or even the nosocomial infections. So already I have dealt regarding this standard safety precautions in the unit maybe in the first unit that is under the infection. So now we will see which are the particular things that comes under this standard safety precautions. So first of all, there is use of PPE. The use of PPE means using personal protective equipment. Second is environmental control. Next is patient care equipment. And fourth one is avoiding accidental injuries. So all this we will see in detail and then followed by what is the main infection control measures also we will see. So first of all, using the personal protective equipment means the person who is taking care of HIV patients or hepatitis B patient, they have to wear the gloves, gown, mask, aprons, okay, at the same time maybe eye goggles and even boots, okay, or shoe covers may be put, especially when they are taking care of the patient, okay, and when they feel whenever they will come in contact with the blood or with the body fluids, always see that the nurse has to wear this personal protective equipment. And you should always see that once these equipments are soiled or it is torn, immediately after that you have to remove it. Okay, don't continue wearing it once it is soiled. Then the face shield, mask, or eye protection should be worn during while whenever you are performing the procedures, you have to wear it. Okay, because chances are there that the blood or sometimes the body fluids will splash inside your eyes. Okay, so you have to use the face shield, mask, and the goggles. Okay. Next is regarding environmental control. Now, environmental control most of the time means that keeping the hospital clean or proper waste disposal methods and all will come. Okay. So, for environmental control, ensure that the hospital is having adequate methods of cleaning. Every day cleaning should be done of the bed, of the linen, okay, how to change the bed sheets, then proper disinfection of the environment or even sterilization of all the equipments, okay, clean the bed rails or the even the bedside lockers, okay, or bedside equipments are there continuously. Patient or patient party will touch or you may perform procedures and all, or sometimes blood or body fluids may be splashed on these equipments, so it is very necessary to disinfect these equipments. Okay, so see that these equipments will be cleaned with 1 is to 10 bleach and water solution. Okay, if at all there is blood or body fluids splashed, you can use 1 is to 10 bleach and water solution. Then always see that there is adequate lighting and good ventilation. Okay, there should be good circulation of air because what happens is if it is a closed environment, microorganisms will multiply and it may result in spread of infection very fast. So see that there is adequate lighting and good air circulation. Other than that, you should see that we have to discard all the waste from the HIV patient or hepatitis B patient and don't mix it with other household waste, whether it is your linen or whether you have used bedpan or kidney trays. See that you are not mixing it with other patients. Okay, you should also be careful so that these blood or body fluids will not come in contact with your skin and mucous membrane, and also see that you are not repeating these usage of these equipments to the other patients. Only one time you have to use it and you have to discard this equipment. Next is how you will take care of the patient care equipments. Now wash the utensils as usual. How do you wash it? Like that only you can wash. Then wash the contaminated laundry separately. Now patients bed sheets will be there, like linen or other things will be there. So you can wash it separately. Okay, in 1 is to 10 bleach and water solution, and all the contaminated articles which is used by the patient has to be sterilized. Okay, and wash the hands prior to the procedures and immediately after the procedure. So adequate hand hygiene also should be followed. And next is avoid accidental injuries. Why you have to avoid accidental injuries? So that you will avoid needle stick injuries or any other prick or puncture injuries. Next is teach the healthcare worker not to recap the used needles. This is very common source of spreading of what to tell is most of the time needle stick injuries happen whenever you are recapping the syringes. So see that once you have given the injection, immediately discard the needle in the puncture bin. You need not recap the needle and then discard it. Okay, and don't attempt to bend, break the needles. What happens is when you're attempting to bend or break the needles, chances will be there you will get prick. Then use puncture proof containers for disposing the needles, or even blades or razors which is contaminated with the blood. Okay, so there are some white cans usually available. It is easily accessible in the hospital. Usually in these puncture proof containers you can place it. Then place reusable syringes and needles in puncture resistant container for transporting to the CSST, that is Central Sterile Supply Department. Okay, but always see that HIV patients syringes and needles should not be mixed. Okay, so earlier days what they used to do is there were glass syringes and all. Okay, and metal needles were there. They used to sterilize it or autoclave it and then they used to use it. Okay, so sterilization and all was performed in the CSST area. Okay, it is a part of the hospital itself, and then after that they will transport it to each ward. But nowadays we are having all disposable items. One time we will use and we will just discard it. Okay, so that is also a better way of taking care of patients equipment. Next is avoid accidental injuries. Now, accidental injuries are very common among the health team members, especially among the nurses. So, again, it is told that never recap the needles or don't go to manipulate the needles or syringes with your hand. Then same thing, do not remove or bend or break the needle, and you can use the puncture proof containers to dispose the needles and all. Okay. So these are the same things. So this is how you can avoid the accidental injuries. Okay. So you must be already knowing the World AIDS Day is celebrated in December 1st. Next is now infection control program. So under infection control program, this infection control program is mainly aims to prevent and stop the transmission of infectious diseases. And the main principles of this infection control program is hand hygiene, using personal protective equipment, environment safety, respiratory hygiene and all. Okay. So infection control program is a comprehensive, effective and supported program to reduce the infection risk and to increase the hospital safety. It will include surveillance, preventive activities and staff training. Okay, we'll see what and all things will come under this infection control program. There is a infection control committee actually, which is responsible for monitoring the care of the nurses or even the healthcare teams, and they are also responsible for conducting programs, then policy implementation. And usually this infection control committee, they have to meet regularly, maybe at least once in a month they have to meet. And there is a infection control team. Okay, so this infection control team is the authority to manage effective control of this program, and they have responsible for everyday's activities in the hospital. And usually in this infection control team there are experts. Usually it will include a doctor, infection control nurse will be there, in charge will be there, nursing superintendent may be there, one lab technician may be there. Okay, So microbiologist, all these member may be a part of the infection control team. Okay? And their main responsibility will be they have to meet at least monthly, and they should usually have a meeting. Okay, so in the meeting what they have to do is they have to deal regarding this infection control and preventive measures, and then they have to discuss if there is any infection in the hospital, whether any ward is having infection, whether there was any nosocomial infection or whether there is any cross infection, that they have to discuss. Okay, then other than that, they will also conduct in-service education programs like training programs and all. They have to conduct for nurses also and for students also. And then they have to follow the protocols like biomedical waste management and universal precautions. And they have to see that each of the staffs who are working in the hospital are following this infection control measures. So they are responsible to conduct everyday surveys. They have to go to each ward and they have to see whether proper disposal of waste is conducted, or they can go to educate the individuals and groups about the risk prevention, transmission, and also regarding the control of infection. So that is the main responsibility of this infection control team. Okay, and each hospital may have usually a different members in the infection control team, but most of the time their main aim is to prevent the infection in the hospital. Okay, so the team is responsible for infection control training for the healthcare workers. The team has to formulate infection control policies, and then they have to see that this plan is implemented. Team should have authority to manage effective control plan. The team should have direct reporting with the senior administration. Okay, and then infection control team, they are responsible for day-to-day functions, as I have told. Okay, and they should be experts and creative. So this also already I have told about the infection control committee. Okay. So that is a multidisciplinary committee responsible for monitoring the policies and then implementing it. Okay. They should see that each hospital department and management are following their infection control policies, and they have to meet at least monthly once. Next is regarding components of infection control. So first one is barrier precautions or barrier nursing. So barrier precautions or barrier nursing means this is a method which is used to reduce contact with infectious item. So barrier nursing means it is usually protecting the nursing staffs from infectious patients or from infections. So what you have to do for barrier precaution? So under barrier precaution, what they will be doing is you have to use mask correctly, you have to use eyewear or goggles, you should use gowns or apron, gloves, proper hand washing, okay, use of mask, all that will come under barrier precautions. Okay, so hand washing is also a part of it. Hand washing means you are already aware hand hygiene, isn't it? You have to use water as well as you can use soap or any other materials to clean. So before you are performing hand hygiene, you have to remove the jewelry, wet your hands, lather well, pay attention to the palm and to the thumbs, okay, and see that you are giving more attention to the nails and in between your fingers. Okay, and hand washing has to be performed regularly, especially before and after the procedure, after handling contaminated laundry or equipments. Okay, and at the beginning of the duty and you even after the end of the duty. Okay, the next is in barrier precautions, it is also very necessary that you have to assess high risk staffs, okay, who are at high risk. You have to assess them. Then every yearly staff health examination should be conducted. You can collect history and you can perform the examinations, and you can also give vaccines to the staffs there. Okay, and see that when you are using the gloves, always there are two types of gloves, isn't it? Sterile and non-sterile glove. And this disposable gloves are also there. See that these gloves are of good quality, they are of correct size and good material, and never reuse them. And if it is torn, immediately you have to change your gloves. Okay, so that you have to always remember. Next is whenever you're using the mask, when you use the mask mostly, whenever you are going into the OT or when you, chances are there that you will get a droplet infection. To see that the mask is also of good quality, it should properly fit your mouth as well as your nose. Okay, and then use it correctly whenever it is possible in the wards, in the OT, or any other departments. Next is whenever chances of splashing of blood or body fluids is there, you have to use your gowns or apron. Okay, so see that along with that, if necessary, you can use your goggles, hair cap, boots, or even shoe covers. Okay, and you have to follow a correct aseptic technique. Next is regarding the sharps. So you are knowing which are the different type of sharps, isn't it? We have got your lancets, scissors are there, scalpels, then even glass items are there, needles or syringes. All this are classified under sharps. So see that you do not get any needle stick injuries, because needle stick injuries with the sharps will increase the risk of bloodborne infection like HIV and hepatitis. So always dispose them immediately after the use and don't go to recap them. Okay, dispose them in the puncture resistant boxes. And if at all there is a chance of needle stick injury, then post exposure prophylaxis has to be followed. Okay, so that has to be correctly followed. Okay, so this is how they are disposing the needles here. Okay, syringes. Next is while you are handling the contaminated materials, always use gloves. Okay, always use gloves. First, you can wipe it with paper towel. You have to use correct disinfectants also. Then wear your PPEs when you are disposing this contaminated materials, especially the ward maids and ward boys. You have to advise them to wear the gloves, and then they have to stick a biohazard label. Okay, they have to stick a biohazard label and then discard in a leak proof bag. Environmental control means physical facility plans have to be done for correct infection control, like cleaning the hospital environment, proper ventilation should be there. Okay, good air circulation, then water pipe examination should be performed at least once a year, proper waste disposal, proper linen collection and cleaning, then they have to examine food safety and quality, and patient protection mainly includes your isolation for all the infected patients or patients with communicable diseases. Okay, then if necessary, what you have to do is avoid the risks, or you can provide them with antibiotics as well as with the vaccine. Okay. Next is regarding proper cleaning, sterilization, and disinfection. So this you have already studied in the first year. Okay. So patient equipments which is soiled with the blood or with body fluids, they have to be handled carefully so that you will not come in contact with the skin and mucous membrane. Okay. And see that heating is the effective means of disinfection. This HIV is inactivated at 60 degrees Celsius in for 30 minutes. Okay, and commonly you can use chemicals like sodium hypochlorite solution and 2 percentage glutaraldehyde solution. Okay, so these solutions can be used most of the time for the disinfection. Next is regarding proper waste disposal. This also you have studied in the first year in detail. Okay. So biomedical waste management is the waste that is generated during the diagnosis, testing, or for treatment, or even research of the biological products, isn't it, of humans or even the animals. So it is very necessary that you discard this waste in appropriate bins. Okay, so whenever the ward maids are collecting this biomedical waste and they are planning for the transport, they have to label it well. Okay, they have to write the date of production, where it is produced, what is the waste category. They have to even measure it, how much kg is there. Okay, and then the in charge has to sign outside. And always see that whenever you are discarding the IV fluid bottles, you are removing the fluids and discarding the bottles only. Okay, don't throw the IV bottles with the fluids inside it. So this is again one more picture of a biomedical waste collection and transport. See that the they are wearing the personal protective equipment and it should not be overloaded. There should not be any spillage also. Okay. Here you can see that it is fully covered. This is the one more way of transporting the waste products here. Don't carry the waste in open bags, okay, and never drag the waste products. Always carry the waste in a secure materials. Then next is safe transportation. So once it is collected, the biomedical waste will be usually transported in the registered authorized BMW transporters only. Then next is promoting safe working environment. So for promoting safe working environment, you have to report and treat occupational exposures if at all you have got. And it is the responsibility of the infection control team to provide personal protective equipment, and proper education has to be given regarding infection prevention. So this is all regarding the standard safety precautions and also regarding infection control for HIV patient.